Hi, what are the testing that we need to do for epilepsy patients to initiate the treatment for long-term follow-up and so on? So there are lots of confusion and sometimes excessive testing for those patients. Let's talk about them in details. The first time we see a patient, the first evaluation, we would like to do a comprehensive evaluation. We can do lab work. The lab work will consist of blood work, so just do CBC, complete blood count, to see blood, white blood cells, red blood cells. This will be the baseline. And if there is any problems, we can address and avoid certain medications. The second thing we do is liver function test and kidney function test. We do the kidney, creatinine, BUN, and the electrolytes, sodium, potassium, magnesium, and so on. So we'll do those testing to kind of establish the patient level, because if we want to start treatment that might affect the liver, the kidney, we have something to go back to. And in certain situations, in children, we can do some genetic testing if we're suspecting a genetic etiology and genetic cause of their epilepsy. So there are some gene panels that we do for epilepsy specifically. And then the second thing, we do EEG. So EEG is a brainwave test that we do for localization of brain activity. It is very useful at the beginning to confirm the diagnosis of epilepsy and also to tell us what type of epilepsy we're dealing with. Are we dealing with focal epilepsy when seizures are coming from one place in the brain, or we are dealing with generalized epilepsy when seizures and electricity is coming from all over the brain? This is very important because every one type of this has a specific treatment, as we talked in the video on generalized and focal epilepsy. The third test is brain MRI or brain imaging. Preferably we'll do brain MRI. Initially we do it without contrast unless we have a tumor or we're suspecting inflammation. And this is specifically for epilepsy. We prefer to do an epilepsy protocol brain MRI with thin cuts through the temporal lobe, and hopefully is read by an experienced neuroradiologist in epilepsy. So those are the initial evaluation, and sometimes we do extra testing if we have a special situations for our patients. All right, we established the care, we start the patient on treatment, and then now we're doing follow-ups. What are the testing that we need for follow-up? So first of all, if we are starting treatments that have blood levels, we sometimes do blood levels measurement to know if the patient is metabolizing the medication correctly and the blood levels are appropriate for the patient. We do not treat blood levels and we do not treat labs. If the patient levels are low, but the patient is consistent on their medications and the seizures stopped, we don't have to just push the medication level higher just to treat the lab. And also if the levels are high, it is not a problem if the patient is asymptomatic. And make sure when you draw blood levels to not take the medications before taking the blood sample. So we prefer it trough levels, means the lowest level in the blood, which can be done early in the morning before taking the medication or 8 hours from the last pill. So it is very important the timing when we do blood levels. And then other labs we can do if the medication can affect the liver, the kidney, the blood. We do monitoring every 3 to 6 months. So for example, carbamazepine can affect the liver, can affect the blood, can affect the kidney. So we do kidney, liver monitoring just for that reason. If we are on a safe medication like Keppra, levetiracetam, or lamotrigine, Lamictal, those are safe medication. We don't need to keep doing blood levels and blood work for the patient. And other tests that people can do for monitoring of the patient is EEG. So EEG is like, this is an EEG test. So it will show us the brain waves, and we do it sometimes to monitor the patient. But there is a problem with EEG doing it too much. We do not do EEG in every visit. That's very important, unless we have something that is significant and we are trying to look at the EEG for changes. So in cases of epilepsy not responding, like resistant epilepsy, we might do an EEG. In cases of we're deciding to escalate the treatment or stop it, or we want to stop and wean the medication, especially in children, doing an EEG can help to guide us. But if the seizures are stopping and they're not happening at all and the medications are working, there is no need to keep repeating the EEG just for the sake of it. Also on the follow-up, repeating brain MRI is not indicated in epilepsy. However, we can repeat brain MRI if there is something that we're monitoring on the long term. So for example, somebody has a brain tumor or a mass or some inflammation that is going on, then monitoring those tumors and those changes in the brain can be helpful by doing a brain MRI. But we do not routinely keep doing brain MRI in every visit. So those are the evaluations that we do for evaluating a patient. in the beginning and on the long term. Sometimes on the long term, after 10, 20 years of using special medications that are affecting the bones, like carbamazepine, oxcarbazepine, like phenytoin and phenobarbital and valproic acid, those can affect the bones. So we have to do bone density measurements, and those are done by DEXA scan, and those can be very helpful to detect that osteoporosis early and treat it early to prevent it from happening sometimes. Those are the evaluations for epilepsy, and we have lots of new treatments for epilepsy and new advancement that you can see in this video for all the new and exciting treatments for epilepsy, and stay healthy and see you in the next one. Salam.